Hi, I'm Ray Barrett, the CEO of the Telehealth Certification Institute. You might be in the position where you're considering adding on telehealth curriculum or building upon your telehealth curriculum for your educational programs. You're not alone in this need. The fact is that educational accreditation bodies for graduate and undergraduate programs related to healthcare have not required telehealth training. Therefore, most programs have not had telehealth program built into their curriculum at this point. And I'm certain, as I'm sure you're also, that students will be providing services in the virtual format. Just as you train them on how to provide those services when they're in the same room as a client, you're probably also wanting to prepare them to provide those services virtually. So let's look at the effectiveness of actually training students on telehealth. This is a study that shows the results of telemental health training. So due to COVID-19, 87 behavioral health clinicians at a large Midwestern children's hospital who were experienced in their field but had minimal previous experience in telebehavioral health were provided training in telebehavioral health. And after being trained, the clinicians reported an enhanced ratings regarding their confidence in facilitating sessions, their comfort with screening patients, and their motivation for providing services via telehealth. However, clinicians remained interested in continued education opportunities around telehealth. And the reason is the training that they received, my assumption anyway, is because they didn't receive very extensive training in telehealth, but they did receive training that consisted of information being provided via PowerPoint slides, a 1-hour recorded video, and other documentation. And the thing is, at our organization, TCI, we've trained over 30,000 clinicians, and over again, the clinicians that we provide, we get the same results. They always say that it helped them with their results, right? It made them feel more confident and competent in the services that they're providing. All right, so what are the typical requirements for a quality curriculum for a healthcare education program? So the first thing that's important is quality, right? So no matter what course you're providing, you want to provide that same high quality standard. And what does that require? It requires that the professor is an expert in the field, right? And that and many other things that we'll get into. And the curriculum, the coursework needs to be relevant. What does that mean? It needs to be relevant to what students are actually going to be doing in the field, what's going to be required of them at their workplace. And it has to be accurate. One thing about telehealth is very, very technical. You got the legal aspects, you got the technology itself. It's super technical. And we see providers of training for telehealth often getting things wrong. One of the things is sometimes they just don't know. They're not IT specialists, they're not HIPAA specialists, privacy law, licensure law, and so forth. But then also sometimes they make assumptions about things rather than looking at the research out there on these things. The other thing you want it to do is you want it to be comprehensive enough so that it's going to meet those essential competencies of telehealth. And you want it to be cutting edge. Telehealth is rapidly evolving, right? Mostly because people just now are like, okay, I guess we need to do this. Let's start looking into this. And people are just starting to really have it on the forefront of their mind. So keeping up with that, because of telehealth being such an important thing or on the forefront of people's mind right now, there are a lot of research is being done. Things are being changed policy-wise and regulation-wise. So you want it always to be up to date. And that's a real challenge. It's a huge challenge. It's incredibly time consuming. The other thing is you want it to be sustainable, right? And what that means is that you have an initial investment of creating a curriculum, but then you want it to be able to stick around in a way that's updated, continues to be quality, had that same quality standard. And the professors need to be able to have access to the answers to the questions that their students have. And they will certainly have a lot of questions. We get great questions all the time. And then the sales proposition for the university's educational program, having it so that students, when they graduate, they can graduate with a credential in telehealth is a great sales proposition, right? It's something they can put on their resume. So now let's cover the specific competencies that should be covered in a healthcare related educational program. What are those? And to start, I'm going to tell you a bit about how it is that we determined what competencies to have within our telemental health training certificate program. So in order to come up with those, what we looked at is, what do professional associations say? And we looked at several professional associations across healthcare fields. And then licensing boards have something to say about it, right? You want your students to be in compliance and adhering to all those standards that they're going to be required to follow, right? And then there's a lot of training requirements from other organizations, which we'll get into. There's organizations that say provide other credentials, and they'll have requirements based upon things that they've come up with. Licensing boards sometimes will have requirements for what clinicians are trained in regarding telehealth before providing telehealth. So we look at all of these out there to make sure that our training meets those, so that people walk away with what they need, right? And then we also participate in all of the telehealth groups out there, the main ones anyway. American Telemedicine Association, you got HIMSS, you got international telehealth groups, and so forth. So we participate in those groups to see, what are they saying? What are they coming up with? What's the new information out there? And then we have a professional review of our curriculum. And then one of the really big things is participant feedback. If you want to know what's going out in the field, right, you listen to the clinicians, you incite feedback and questions and have them tell you what's going on, what are their needs, what are they looking for. So we are constantly fine-tuning our training program according to the feedback that we get from our thousands of clinicians that we're training every day. So some organizations that have also come up with competencies that are essential for telehealth. One is the Center for Credentialing and Education. Now, they're an affiliate of the National Board for Certified Counselors. And why that's important is because they've been providing a credential in telemental health since 2004, right? For a long time, they've been doing this. It was originally called the BCC. Now it's called the BCTMH, Board Certified Telemental Health Provider Credential. And for their current update of their credential, they identified 6 core competency domains, which have been developed with the input of several subject experts in telemental health services, and that are supported by current telemental health literature and education. And to address those competency domains, they identified 58 associated skills and 67 knowledge areas. These all can be found on their website. And since our program is an approved training curriculum for people to meet the training requirement for people to acquire their credential, we have to make sure that all of those domains and skills and knowledge areas that they've identified are incorporated into our THTC program. So it's a pretty rigorous process. Then we have the American Psychiatric Association and the American Telemedicine Association, where they co-created practice guidelines for telemental health, right? And this was in 2018. But they do a very thorough, great job. Remember, telemental health is not new, okay? It might be new to some people, but it is not new by any stretch of the imagination. So they've been working on these competencies for quite a long time. So we incorporate these. Another one is, this is a recent publication. And in this article, what they did was, they looked for overlap in 5 telepsychology guidelines at the time that it was created, and they presented a consolidated model including 9 practice domains influenced by practice setting and modality. So to let you know the guidelines that they looked at to do this, one was the American Psychological Association. Another one was the Australian Psychological Association. If you don't know, in terms of telehealth, the Australian, Australia has been doing a lot with telehealth. They have a lot of publications. They do a great job with it. And then the New Zealand Psychologist Board, the Ohio Psychological Association, and the Ontario Psychological Association. I really like what Canada has been doing with telehealth. It's really interesting. Another one is the Association for American Medical Colleges. Now, this is for physicians, right? But AAMC has a telehealth advisory committee, and they worked for 2 years to develop telehealth competencies for physicians. But they say these things are evolving and changing. It constantly needs updating. And they have a publication in 2021. So we will take a look at, the competencies that they've come up with, and they've identified 9 domains, right, with skills, underneath each of those domains. So there's a lot that we've looked at here in terms of creating our curriculum for telemental health. So rather than getting into the weeds of each one of these, what I did is I put together a spreadsheet where I listed out those main domains for competency areas for each one of these on a spreadsheet to compare and contrast all of these. So if you take a look at these, on the first column is our THTC program, okay? And then we have all these other sources for looking at this. So, under ours, we have Introduction to Telemental Health. And with the other sources, what's relevant information? How do theirs line up with it, basically? So how do theirs line up with our domain, Introduction to Telemental Health, which is one of the modules in our THTC program? So the Center for Credentialing and Education, they have a couple that line up with that. It's Professional Orientation to Telemental Health and Disclosure and Informed Consent. And then the Association for American Medical Colleges, they have one on using telehealth. And then we have on ours legal aspects for telemental health, and then several of them. Each one of them actually has a domain that relates to that. And then we have one on privacy law. We have one on ethics in using technology and behavioral health. And again, a couple of them have domains that line up very well with that. And then we look at the ethical aspects of selecting technology. So this, we get into the weeds with how to select technology, what to look for, and many different aspects of that. And each one of the others also addresses the importance of that. And then we have a module on screening for fit, and then emergency management planning, where 3 of them have one that fits with that very nicely. And then the clinical skills of how do you actually provide services both through video and phone. And most of them, you can see 3 of them here, have ones that line up perfectly with that. And then cultural competence. And they actually, actually all of them find that important, of course, but in terms of, just placing these on a spreadsheet, 2 of them line up really nicely. So, this is not a perfect fit, because under each one of these domains, of these sources, there's several different skills that they want addressed. And under these basic modules, general modules that we train people on, there's several skills that are included in those. So it's not a perfect lineup, but it gives you a sense of what these essential competencies are for telehealth and how it is that our THTC program addresses these. Now, you'll see that the one for psychology, the consolidated model for telepsychology practice, that article, they have one on assessment, which is doing, it's doing psychological assessments, using measurements. And we have a specific course on that is separate from the THTC program, because most behavioral health clinicians don't need that specific course. And then one on research and evaluation they have for researchers. We do not have that included in our THTC program. And then they have one on supervision. Well, we have separate courses, several, specifically on supervision and telehealth, but most clinicians don't need that course, right? So the THTC program provides those essential competencies for telemental health, right? So now going back, in terms of the THTC program and the sales proposition for those looking at your program, one of the great things is that when they graduate, if you incorporate the THTC program, they will graduate with a credential in telemental health in good standing, right? That's known, and that's a great program. So ways that they can do that is obviously they can earn our THTC certificate by completing the full program. And then, like I said, the only credential in telemental health provided by a professional association is the one through CCE, and we're one of the approved training providers for that. So by completing our program, after they get their associate licensure or get their NCC if they're a counselor. Now, this credential is for all behavioral health professionals, not just counselors. But if they are a counselor and they have the NCC, National Certified Counselor credential, or if they're any other behavioral health professional and they have at least their associate level of licensure, like being licensed under supervision at least, then they can apply for the BCTMH credential. So now let's look at how is it that your graduate program or undergraduate program can incorporate the THTC program. There are many ways that you can do this. We customize this for the university and for the professors in terms of what works best for your program. However, in general, one option is that we would license you the program where professors get access to the full THTC program. And what we do is we have it broken into segments of 30-minute video sessions, video clips. So there's a 30-minute video clip, and then there's exercises and or discussion questions that go along with it. And we break that up into several segments, right? There's like 31 half-hour segments used for the program. We also include post-test questions. And then the professor also gets access to our 200-page online document, which is a review guide. So if anything comes up and they need quick access to answers, they can use that review guide that's broken down into several chapters and subchapters to find the answers to the questions that they're looking for. And then the professors can simply show those videos during their course to their students, and then they have the discussion questions and activities to use with their students, so they really get that integration and experience with telehealth. And then they could download the post-test to use in their course without having to recreate this stuff and make it up to date and relevant, etc. The other option is to simply allow students to have their own direct access to our full THTC program, where each of them would get their own login credentials for the full program online. And then the professors would get access to monitor the progress of the students on our platform. Now for a demonstration as to what it looks like if you're using our product. If you're a professor that has access to our program, on our website, this is a demonstration of a user already being logged in. So on our website, you would simply click My Courses. And on here, you'll see two things listed under your courses. One is the THTC Certificate and Review Guide. And that is the over 200-page document where you can quickly find answers to questions you have. And then there's the THTC program. So let's click on that and you'll see what that looks like. So it loads on the page and it's broken into modules. It also will have the branding of your university with your university logo and colors. And then it's broken into these 10 modules. and about 31 sections that are a half hour in length. Okay, so it's 30-minute sections that are a half hour each. So what it is you'll have a video that is approximately 30 minutes long, followed by discussion questions and or activities that you can use with the students. And then for each module, there's also a post-test that you can download as a Word document so you don't have to create exams on your own. There's also closed captioning built in. So when you're having your class, your course with your students, you would simply go to the module, you would maximize the screen for the video, and you would play the video. The video will play, so it'll be instruction, and then you'll have the discussion questions and activities with your students. And then to look at the review guide, this is a quick access, again, to look up answers to questions that students have of you. So if you click on the review guide, it will load. And you can see on the left-hand side, there's many chapters and sub-chapters, which makes it easy for you to find the answers to those questions that you're looking for. You just click on any chapter and the content loads for you. However, we want to know from you what's going to work best for you in terms of integrating telehealth training into your educational program. There's several ways to do it. Different ways work for different universities and different programs. So reach out to us and let's have a conversation and we'll find out what's the best fit for you.